Hi, everybody. This is my audience. Say hi, Nikki.
Hi.
I think you can see her. Other people were supposed to come, but they didn't show up, so hopefully this is okay. I'm going to give her the computer so she can record me by holding the computer, and hopefully y'all can hear me. So here you go. Okay, so in the past weeks, we've been talking about teething babies and what they go through when it starts, what you can do, the symptoms, what they go through, and the remedies that you can do so you can soothe their pain and their gums. I don't know if you can hear them, but there's some babies crying in the background because they are teething. So the first thing that I explained in the very beginning was the time frame. Babies usually teeth from 3 months to 12 months, depending what they go through. I read upon Mayo.com, MayoClinic.com, that some babies experience, pain, some don't. Some have higher pain tolerance and some don't. It just depends on the baby, him or herself. Usually babies that have the pain usually come up with a fever due to the pain and so forth. Another thing is by the time they reach 2 years old, they have a set of 20 teeth. And that's a lot for, imagine all those teeth coming in at once in the 2-year period. Also, some babies are born with teeth. Some may describe the teeth as milk teeth, and or they have the regular teeth that you have now that babies get within the 3 to 12 months, and they keep those teeth. Milk teeth, they usually fall out, and that's fine, and then their teeth will go ahead and grow as normal. Another thing is the symptoms. Babies tend to drool a lot due to their gums getting ready for the teeth to come in. In the process of drooling, they tend to drool and then it stays wet around their mouth onto the clothes and so forth, which causes rashes that they may have. The rashes that they may have is normal. I mean, there's nothing you can do really about the rashes. Maybe have bibs. I found it more convenient to have plastic bibs than cloth bibs because the drool can actually soak into the cloth bib, which will get on the clothes. If you have a plastic bib, it basically just slides right off. It's like a water repellent kind of type bib. Another thing is another symptom or what they go through is they may have the high temperatures or a mild temperature, just depends on how much pain they're going through and how much teeth are breaking through those gums. It determines, because usually babies' teeth come in at twos. They have 2 that come in at the bottom, 2 in the top, or they have all of them that come in at the same time. So it just basically depends on how the baby grows his or her teeth. And at the same time, we as parents have to have a lot of patience, because sometimes you have sleepless nights, and that's another symptom. Babies tend to lose sleep due to their pain, or babies tend to lose a sense of appetite due to teething. And it's all normal and it's fine, but it's not fine to the babies. We just need to find different remedies, which brings me to my next topic of what you would need to do as a parent to help the baby deal with it. There's remedies such as buy them teething toys. In the very beginning, if you remember, I had demonstrated a teething toy that had the gel light filled teething ring on it. You can put it in the freezer, have it frozen. That gel inside of it will freeze, and it's a good it soothes the gums because it's hard and it's cold. However, upon doing more research, according to MayoClinic.com, they actually stated that having a gel-based teething ring is actually not it's not safe due to once those teeth break into their gums, they can pierce into that liquid-filled teething ring, and that liquid-filled gel can go inside the baby's mouth. So if you do have a liquid-filled teething ring, you must omit it and not have it around your kids, because that fluid can go inside their mouth and who knows what can happen. The best thing to get are cloths. If you get a cloth, a little baby towel, they can soak it up with their own saliva, and that rubbing against their gums will help them with the soothing and the pain that they're having. Or rubber toys would help them. And if it gets too bad, I would suggest Tylenol. But you wouldn't want to give them too much Tylenol, because too much medication can damage the liver. You don't want to get their bodies immune to Tylenol, because they will not be able to fight off infections later in life. And that would be my last remedy to do, is give them medication. Another good soothing remedy that I find very useful is taking them a bath in lavender soap. There's a lavender shampoo / body wash. Get it a lukewarm bath and put that lavender in there, and then follow up with the lavender soap. Lavender is an essential oil, basically, that relaxes your body and puts your body at ease. And if the lavender is able to put an adult body at ease and relax, so much more for a baby. And they put them right to sleep. I've given my kid many baths throughout the day, even with lavender, and it helps them soothe and be calm throughout the day. Because at the end of the day, it's them, they're the ones that going through the pain. We're just along the ride with them. And we as parents don't like to see our kids in pain, so we will do anything and everything to help them deal with that. And I guess that's it. And my references are parents.com and mayoclinic.com. Thank you.